Good afternoon, Miss. I am Arson Vine. I'm Caban from BSN2 Weidenbach, and today I'm going to perform assisting and catheterization, which includes straight catheterization and indwelling catheterization. So, what is assisting and catheterization? It is assisting in the introduction of a catheter into the bladder through the urethra for the relief of urinary retention or for emptying the bladder completely. Objectives: to relieve acute or chronic urinary retention, to promote urinary elimination, to obtain a sterile specimen, to obtain accurate measurement of bladder function, to provide continual urinary bladder drainage, for preoperative and postoperative drainage, to measure the amount of residual urine after voiding, to monitor the output of critically ill patient, and to prevent skin breakdown in incontinent bedridden patient. Straight catheterization. Preparation of equipment. Obtain treatment card from the nurse and check with doctor's orders to save time and effort. Bring equipment to bedside table. Check lighting source. Preparation of the patient. Identify patient and explain the procedure and need for the patient to keep knees positioned during procedure. Describe pressure sensation that will be felt during catheter insertion. Patient will feel reassured if the procedure is explained and if she is handled gently and considerately.
Good afternoon, sir. Ako galit sa Nurse Vine. Pwede ko man lang tayo mga identification ban, sir. Sir, sir. Sir?
Screen the patient to provide privacy. It reduces client embarrassment and aids in relaxation during procedure. Place bed in high position and lower side rails on working side. Promotes use of proper body mechanics. Place patient in dorsal recumbent position for females and bring knees up and out and may need assistance to keep knees in the position male. This position provides for good visualization of the urinary, meatus, and perineal structure. Drape the patient with top sheet to expose perineum and avoid unnecessary exposure of body parts and maintain client's comfort. Assist patient to side near you. Loosen foot part of the top sheet. Use diagonal draping. In males, expose only the penis and a small surrounding area. Provide perineal care if needed. Presence of microorganisms near urethral meatus is reduced. Place tray between thighs facing foot of the bed. Provides easy access to supplies during catheter insertion. Adjust drop light. A flashlight may be used. Permits accurate identification and good view of the urethral meatus. Place waste receptacle at an area near you. Wash hands for asepsis. Let doctor open the pack of sterile gloves to put on gloves. Allows doctor to handle sterile supplies without contamination. Observe sterile technique in offering pack of towel and with hole for draping to maintain sterility. Place adequate amount of lubricant over the non-dominant hand after the doctor cleanses urinary meatus. Allows easy insertion of catheter tip through urethral meatus. Pick Foley catheter size according to age. Remove outside pack observing sterility, ensuring that the tip of the catheter will be offered for lubrication and insertion. Outside pack is unsterile. The doctor will pick the tip of catheter for lubrication. Instruct client to breathe through the mouth while doctor inserts catheter to the urinary meatus. Relaxation of external sphincter aids in insertion of catheter. Place distal end of catheter in sterile bowl to measure urine volume or attach to drainage bag as indicated. Collection of urine prevents soiling of client's bed, linens, and allows accurate measurement of urinary output. Offer 10 cc of syringe filled with distilled water to the doctor to inflate inflation balloon. Inflation of balloon anchors catheter tip in place above bladder outlet to prevent removal of catheter. Attach end of catheter to collecting tubes to drainage system, unless already connected to bag. Place drainage bag in a dependent position. Close urine drainage is established. Dependent position of drainage bag promotes flow of urine away from the bladder. Tape catheter. In female client, tape catheter to the inside of the thigh with strip of non-allergic tape. It allows for slack so that movement of thigh does not create tension in catheter. Anchoring of catheter minimizes trauma to urethra and meatus during client's movement. Catheter position over the thigh prevents kinking. Non-allergic tape prevents skin breakdown. For male clients, tape catheter to top of his thigh or lower abdomen with penis directed toward abdomen. Allow for some slack in catheter so that movement does not create tension in catheter. Anchoring catheter to lower abdomen is thought to reduce pressure on urethra at junction of penis and scrotum, thus reducing possibility of tissue necrosis in this area. Be sure there are no obstructions or kinks in tubing. Place excess coil of tubing on bed and fasten it to bottom sheet with clip from drainage set or with rubber band and safety pin. Patent tubing allows free drainage of urine by gravity and prevents backflow of urine into bladder. Assist client to comfortable position. Client's comfort and security are maintained. Instruct client on ways to lie in bed with catheter. Side lying facing drainage system with catheter and tubing drape over lower thigh. Side lying facing away from system, catheter and tubing extending between legs. Urine should drain freely without obstruction. Placing catheter under extremities can result in obstruction as of compression of tubing from client's weight. When client is on one side facing away from system, catheter should not be placed over upper thigh. This forces urine to drain uphill. Caution client against pulling on catheter. It reduces trauma to urethral meatus. Wash hands. It reduces spread of infection. Palpate bladder and ask if client remains uncomfortable. It determines if distension is relieved. Observe character and amount of urine in drainage system. It determines if urine is flowing adequately. Record type and size of catheter inserted, amount of fluid used to inflate balloon, characteristics of urine, amount of urine. Communicates pertinent information to all members of healthcare team. Evaluation. Residual urine measured, sterile urine specimen obtained, catheterization performed using sterile techniques, retention catheter inserted without difficulty, bladder emptied when patient is unable to void.